COVID-19 variants refers to the SARS-CoV-2 virus. It's an RNA virus. All RNA viruses have random mutations over time. Most of those mutations don't impact how the virus works. Some of them may go away spontaneously, but others over time can change how the virus behaves and interacts in infections in us, human beings. They're detected by genome sequencing, so that means they have to sequence the entire virus. That's very labor intensive and time consuming, and so it has to be done in specialized labs. And so it's been done more recently, which is why it's more recently that we're hearing more about these variants. Current COVID diagnostic testing does not detect these variants. It just determines that there is SARS-CoV-2 virus present, the virus that causes COVID-19. But to detect a variant, you actually have to take that isolate from a positive diagnostic COVID test and send it to a reference lab where they do this more labor-intensive, time-dependent sequencing of the entire virus. So it's more specialized testing for determining if it's a variant or not. The big challenges that we see with these COVID variants, and they're expected to occur over time. We see that with other viruses like influenza, but we always worry how it's going to impact our treatments and then the vaccines that are available. Also, the questions come up, is it going to change how this interacts in people? Is it going to cause other problems in the disease processes that we currently see? There are a few COVID variants that are of primary concern at this point. One is been called the UK variant, or B.1.1.7, this nomenclature that's used for it. And it does appear to be more transmissible to other people. There are a couple other variants that have also come up in the news. There's this B.1.351, or also known as the South Africa variant, that shares some mutations with the UK variant, but it has another one that causes problems called E484K, and then another one from Brazil, which is called P1, that shares that same mutation. They appear to be more transmissible to other people. Now, the exact reason for that is not entirely clear. It's possible it might cause a higher viral load, which makes it easier to spread, or it might allow the virus to bind more easily to the receptors in the person that it's infecting. But it does appear to be a little more transmissible to other people. There's no evidence at this point that's been published that shows that they're deadlier. There is a concern that's been raised with the UK variant that it might be a little bit cause more severe disease. The problem is trying to tease that out, because if it causes more infections because it's more transmissible, that means you'll see more cases. And if you see more cases, you're going to see more people in the hospital and unfortunately more deaths. But there's no direct evidence right now that suggests it's more deadly. That's still being investigated. The good news is that the exact same public health interventions that work against COVID virus, the existing strains, work against these variants as well. And so I think this is really a call that we need to continue doing what we know is effective. We're all tired of doing it, but we know it works. Wearing the masks, avoiding large crowds, and hand hygiene. These all work against the variants. The other thing that we need to do is get more people vaccinated, because the overall number of cases we can decrease, we reduce that risk of spinning off these random mutations that causes more variants, which can be transmitted to other people. We're preventing opportunities. So if we can decrease that overall case number, we can decrease the chances that more significant variants can spin off. People obviously are concerned that these vaccines still need to retain their efficacy, since we're working to get everybody in the globe ideally vaccinated to get them protected. Fortunately, the vaccines still have efficacy. So we know that the Moderna and Pfizer vaccines have very high efficacy. The Johnson & Johnson vaccine also has good efficacy. They have looked at Moderna and Pfizer in the lab to see how it works, specifically using blood from people that have had the vaccines against these new variants. There's no change in how it works against the UK variant, which is great because that's the most predominant one in the United States. Against the South Africa variant, the vaccines do take a little bit of a hit, but they still have efficacy. They still retain some ability to provide protection. And against disease that gets people hospitalized and death, they actually work very well. They haven't seen hospitalizations or death with the vaccine. So they still provide protection for those cases of worst case scenario. At this point, it looks like we're going to be dealing with COVID-19 for a long time to come. And so I think that we should expect that we would see it to occur, and there will probably be some seasonal variations similar to what we see with influenza. This past year has been kind of historically unique in that we have not seen much influenza, just very few cases. And so we'll have to see how influenza plays a role in this, if that starts to come back some. But COVID-19, we should at this point anticipate to continue to see for now, at least for some time, and very likely may have seasonality like influenza. People have raised questions about the Johnson & Johnson vaccine and its efficacy. What we know is the Moderna and Pfizer vaccines had very high efficacy, which was great, higher than expected, at around 95% for both of those. The Johnson & Johnson overall efficacy has been reported out as about 66% overall. Now, what that efficacy means is it prevents any infection from occurring, and about 66% overall. They did this vaccine study in several different countries, and so there was some variance depending on which country it was performed at. In the United States, it was around 72%. In South Africa, where they have one of these variants that's circulating as the predominant strain, that decreased some, but it was still at 52%. And so there's a little bit of variance, but I think the important thing is not to compare the efficacy numbers from the Johnson & Johnson vaccine to these Moderna and Pfizer vaccines, because if you look at some other outcomes of great importance to us, the Johnson & Johnson vaccine, and during those trials, they didn't have any patients that were in the hospital or died. And so really you could say that that was 100% effective in preventing worst case outcome, somebody being hospitalized on a ventilator and dying from COVID-19. Now there's going to have some decreased difference in protection, and ideally we'd like to see it the same as the Pfizer and Moderna vaccines, but I don't think we should look at this as an ineffective vaccine. It certainly has a lot of great protection. We definitely should have people getting whatever vaccine is available to them to protect them. There are some big advantages with the Johnson & Johnson vaccine. One is that it's a one-shot vaccine. So that brings up a lot of benefits. One of the challenges with the Pfizer Moderna vaccine is that you have to do 2 doses in the series, right? And so you have to schedule people and make sure they show back up on time appropriately. By having a 1-dose vaccine, you can go into communities where it's difficult for them to get to vaccine sites. You could look at things like mobile vans or buses where you can provide vaccine to communities that don't have the same resources. For global transport, that also makes it easier. Another big benefit is that it requires refrigeration, but not these ultra freezers. So it can be stored, it doesn't have to be stored at -80 or -20 degrees. It can be stored in the refrigerator, which also makes it much easier to transport. And for global purposes, distribution, without that cold chain storage issue that we see with the mRNA vaccines, the Johnson & Johnson vaccine is going to be much easier for getting our global distribution that we all need as a global community to get this pandemic under better control.